Medical workers, what's the craziest lab result you've seen in a patient? Sent a patient for an ambulatory sleep study when he was referred to us for suspected sleep apnea. Was very tired and apathetic when he came in. His test came back with an AHI of 127, with the longest apnea episode lasting 77 seconds. Essentially meaning he was stopping breathing 127 times every hour. Called him back urgently to start a CPAP trial. Moved to VPAP, and last I had seen him, he was happy, cheerful, and about 35 kilograms lighter than when we initially saw him. Next story. Not technically lab results, but on intake, my best friend's pulse ox was 44%. The oxygen she was getting was purely through agonal breathing at that point. She was immediately rushed back, put into a medical coma and intubated. Life support for 4 days, ICU for 6. She had a triple whammy of influenza, strep throat, and pneumonia. Needless to say, she was incredibly close to death, and it amazed everyone that she made it. Next story. Elderly woman with a pulse rate of 8. I figured the pulse ox was crapping the bed, as they often do, so I told my coworker to take it off the patient and put it on me, to check if it was the machine acting weird or not. Coworker put the pulse ox machine on me, and it showed a normal, healthy pulse rate almost immediately. My coworker and I looked at each other, looked at the patient, looked at each other again, and just went, oh, F. Next story. As a lab tech, I've seen quite a few. The highest glucose I've seen was 1750. Highest accurate potassium was 7.9. Rule of thumb is 8 and you're big dead. Hemolyze samples make it shoot up, so it's likely not real, but that one was. I learned our lactic acid analyzer only goes up to 40. That guy unfortunately didn't live long. I've seen a urine sample with so many crystals I couldn't see anything else. My most recent was an 89-year-old man with what appeared to be a lot of very healthy-looking sperm in his urine sample. I was shocked at the quality and quantity of them, lol. Next story. Next week is National Lab Week. Thank you to all the unsung heroes in the labs. So many people think, oh, the doctor ran some tests, means the doctor physically ran the tests. There's an entire department at hospitals spitting out this critical data. If you think nurses are underpaid, I've got an update for you. Those professionals have college degrees but are chronically overlooked. When our hospital was aiming to have all employees make $20 an hour, no mention was made of raising the starting MT salary above $23.25. I wonder what it is today. I can answer that because I have family in the medical field. It's still criminally underpaid. It's crazy to me how people that can save lives make a certain salary, but if you're a professional athlete or a famous content creator, you get paid dozens and hundreds of times what they do. It's just, man, it's so crazy. Next story. My mom was a type 1 diabetic. Her glucose frequently dropped at night when she was sleeping. I was home visiting and pregnant and had to get up to pee a bunch at night. Both my mom and I were sleeping on the sofas in the family room. I take a whiff every time I walk by to pee. Once her glucose dropped, she'd start sweating out the excess insulin. Low blood sugar sweats are something you can smell if you've been around it at night. She smelled low, and I had a hard time rousing her. I got the glucagon out and got out her food. Just before I gave the glucagon, I tested her blood sugar. My dad was a real ass about using the glucagon injections because it was $150 for 3 doses, 20 years ago. I felt like I had to justify giving the glucagon. Her blood sugar was 12. It's a miracle the glucagon worked. I still have to give her Pepsi and make her a sandwich. I wish she had lived long enough to get a continuous glucose monitor. It would have completely changed her life. Next story. Not a medical worker, but I scared the crap out of someone once with a blood pressure reading. Was 60/40. I was 19 and felt totally fine, but the nurse triple-checked the reading before bolting out of the room and bringing the doctor, along with damn near the entire medical team at the office and the room. Been since told I have chronically low blood pressure. Next story. As a family member of the patient, I once had a family member test for an A1C of 19.2%. Ideal normal range is under 5.7%. The staff at the hospital sounded both surprised and a bit horrified when they informed us of that result. Next story. Common medical terms I've seen on this thread that people outside the medical field may not understand. CBC, complete blood count, a test that counts the different cells in your blood, like red blood cells, carry oxygen, white blood cells, fight germs, and platelets, help stop bleeding. Hemoglobin, HGB, the part of the red blood cells that carries oxygen around your body. Low hemoglobin can mean you're anemic, tired, and weak. Hemoglobin A1C, a test that shows your average blood sugar over the last few months, mostly used for people with diabetes. WBC, white blood cell count, tells how many infection-fighting cells are in your blood. High numbers can mean infection or inflammation. Platelets, tiny pieces in your blood that help it clot so you don't bleed too much when you get a cut. Lipid panel checks the fats in your blood, like cholesterol, to see if you're at risk for heart problems. TSH, a test to see how well your thyroid, a gland in your neck that controls energy and growth, is working. AST/ALT, tests that check if your liver is healthy. BMP, basic metabolic panel, a group of tests that check things like your blood sugar, calcium, and how well your kidneys are working. INR shows how well your blood clots, especially if you take blood thinners. So although this wasn't much of a story, I personally very much appreciate the the medical info dump there. Those are things that I needed to know, and I think some of our listeners could stand to know that as well. Next story. Addictions field. LFTs. Gamma-glutamyl transferase. Top end usually 130. Patient's result was 5980-ish. 3 bottles of red wine a day for many years. No idea if he's still alive. The scarier thing is when the results come down, people believe they're getting better, but it could simply be there's no liver cells left to measure. Next story. Hemoglobin 1.9. She walked into the ER, admittedly dizzy, but still walking, then refused blood transfusions. Blood glucose 1,472. Stage 4 gastric cancer patient with uncontrolled diabetes. Woke up and felt fine after a couple hours of an insulin drip. Blood glucose 19, rectal temperature 89.6. Same guy, nursing home, said he was fine 3 hours prior. ANC 0.0, came in for a fever. Lactic 14, my grandma a week before she died of sepsis and pancreatic cancer. Blood pressure of 312 over 199. Big fat dude slipped in the shower and hit his head. Had a brain bleed the size of a baseball. Still awake, but very confused and pissed off as F. He got clovetapine. Troponin over 23,500. I didn't know our lab had an upper troponin limit. Blood alcohol over 0.6. Every day for 3 years straight. Next story. A friend of mine had a glucose level of nearly 950. When the tech took the sample, his face went white and said, "That's not good. I need to get the doctor." Turns out the feeling he had the last few days wasn't the flu. It was sugar accumulated in his body. For reference, it's supposed to be between 75 to 100-ish. I've been in a fair few ER-worthy visits, and I've never seen a doctor have any type of reaction like that before when she came in the room. Edit. Wild part about all this is that he was diabetic for about 3 months, then his body figured itself out, and he didn't need to take the insulin anymore. He just watches what he eats and takes a needle test once a week. It's crazy. Next story. I've had a couple weird ones. Best I'd ever felt in my life. Lost 60 pounds in 6 months with no real change. Doctor said, "Keep it up," and I said, "Maybe we should test." I thought cancer. Did a blood test. Blood glucose was 880. A1C 13.2. So diabetes. Went in with severe cramping. Did blood tests. Leukocytes was over 30,000. Immediate emergency. They thought my pancreas was shutting down. Ultrasound showed huge gallstones, several days of nothing in my mouth, trying to get my pancreas to calm down. On the third evening, the nurse, I still call her Ratched, comes in and says, "They aren't going to do the surgery. Your leukocytes are still too high." And I got scared. "Oh no, how high are they?" 5,000, she says. My wife and I started laughing. "Don't laugh, you could die." They were over 30,000 when we came in. "Don't you lie to me," she said. "Oh, please go check. I don't want to be wrong." That's what they said and what I remembered. She came back a few minutes later. "They'll do surgery tomorrow," was the last time she spoke to me. They removed my gallbladder the next day. Next story. I am resident here. Our clinic often has patients who get lost to follow-up. A patient came in just under 2 years after his last appointment where it was revealed he had a ferritin of 1. I repeat, a ferritin of 1. Poor guy also had hemorrhoids and said he was bleeding every day. Continuous fatigue. No kidding. Nothing to replete your hemoglobin stores. The crummy part is that the ferritin was a lab from a while ago and he never followed up for intervention. We're on track now, though. Next story. I'm not a medical worker, but I did give my doctor, in his words, a small heart attack. I had pneumonia and went to the doctor. They decided to do a chest x-ray. At the time, I was wearing a necklace that was very dear to me, a gift from my brother. It was basically a bunch of rope tied into all sorts of knots, with a pendant made of bone. The x-ray technician told me to take it off, and I explained that it wasn't coming off unless she brought scissors. The knots were everywhere, and I couldn't get it over my head. She made a gesture that I interpreted as, you know what, screw it. So I just tossed the necklace over my shoulder and went ahead with the x-ray. Sometime later, I got called into the doctor's office. He was sitting there, visibly shaken. He told me I had cancer, then showed me the x-ray, a solid black mass near the top of my lung. I panicked for a moment, but then I realized the shape looked familiar. After connecting the dots, I explained what has happened and even showed him the necklace. Turns out, no cancer, just plain stupidity. We both laughed nervously at the situation. Next story. Not a worker, but a patient. I'd been suffering with chronic diarrhea and stomach cramps for months, and while waiting for yet another appointment with a gastroenterologist, I came down with a wicked fever. I tried just treating it with Tylenol and Advil, but after about a week, they weren't touching it. I left work early on a Thursday and told my boss that I wasn't going to be in the following day, and went home to rest. After 1,000 Tylenol and 800 Advil, and soaking in a lukewarm bath for an hour, my temp was still 103. I decided to go to bed and go to the ER if I didn't feel better in the morning. I woke up in the hospital on Saturday. Out of the blue, my mom decided to stop in to see me, and found me unresponsive in my bed, soaked in sweat and feces. They rushed me to the hospital by ambulance, and I had a fever of 105 and a BP of 60/40. They packed me in ice packs and started a sepsis protocol. I was so dehydrated and had such poor kidney function from the low BP that I had received 4 liters of saline before I produced urine. Turns out I had been suffering from severe Crohn's disease for months and had a perforated colon causing all the other symptoms. The reason I even told the story here is because the nurses all agreed they had never seen anyone with a BP that low not die. Next story. My then 15-year-old daughter needed a bone marrow biopsy to figure out some weirdness with her blood counts, and both the samples they got were pale yellow. They took one sample from each of her hips and found 2 living cells, total. The rest of the cells were dead and completely unidentifiable. Apparently, they can sometimes tell what dead cells used to be. No idea. They just told us, we don't know what's going on, but this isn't a good sign. So they gave it another try and did 5 samples from each hip. No living cells whatsoever. Then they decided to try other bones. The sample from her upper arm was also completely dead, but the one from her shin wasn't. It was, however, 94% leukemia, AML. That was in 2018. She spent most of 6 months in the hospital, but made it through and is doing well now. Next story. Hemoglobin of 2. I thought it must have been extremely diluted or that I'd missed a clot when I ran it. Called down to ED for a recollection. It was 2 again. I called one more time to talk to the nurse. This result is incompatible with life. Are you sure it was drawn below the IV line? That it's not contaminated? Oh no, 2 makes sense. The patient is covered in bed bugs. We pumped like 4 units of blood into the patient, but they still didn't make it. Dude got eaten alive by bed bugs. That sounds like an absolutely horrific, nightmare-fuelish way to go. Man, just feel so bad. How does that even happen? Next story. So I take my kid to the pediatrician for a checkup. Blood pressure comes back high. Scary high. Like stage 2 hypertension. They take multiple measurements with multiple instruments and confirm. Obviously, this was very concerning. We got a home BP monitor and instructions. Call the school nurse to talk about monitoring during the school day. The appointment ends. Kid runs to the bathroom. Turns out he was holding in like 2 Subway footlongs and just really needed to take a dump. Everything was fine. Next story. I was the doctor covering a psychiatric hospital on night shift. At the tail end of the shift, around 6 a.m., nurses from one of the old age wards called me saying one of their patients had been complaining of chest pain since midnight, but they didn't want to reach out at that time as they didn't think it was so serious to disturb me. I go check the guy out, and he's looking chill and saying his chest has been hurting a bit overnight. I take a heart tracing from the guy and it's showing global ST elevations, i.e. on the terrible end of the spectrum of how bad a heart attack can be. Took a blood sample to check troponin, a chemical used as a biomarker for measuring heart damage, and got the guy sent to the nearby general hospital as quick as I could. That blood sample showed a troponin of around 10,000 Ng/L. For reference, a normal healthy reading is 0 to 14. I made it very clear to nurses afterward that it's my job to be disturbed if someone is complaining of a chest pain, no matter how minor it may seem, even at an unsocial hour. Next story. Not a medical worker, but a patient who gave quite a shock to his doctors. I'd managed to crack my head on the landing as I was going up the stairs with quite some force, whilst hurrying to try and sort some things out. Took a chunk out of the brickwork, and felt fine, barred the pain from where I'd hit it. Went to work a few hours later, and as I was starting my shift, dropped to the floor like a sack of spuds, according to the member of the team who I'd been talking to at the time. One ambulance ride and an x-ray later, it's revealed that I had what could be best described as a spider web of hairline fractures going across my skull from where I'd bashed it. 5 months off work for the concussion to go and the fractures to repair themselves to the point where I was declared fit to work. Though I had to take it easy still. I returned to work to a lovely welcome present from my oh-so-loving team, a bike helmet and multiple boxes of painkillers. Next story. Normal range for adjusted calcium in my lab is less than 2.59 mmol to L. I saw a 6 ounce. I didn't realize having chalk for blood was compatible with life, but hey, a load of IV fluid and a slug of bisphosphonate later, and she was still there to tell me she hadn't pooped for a week. I also once had a patient with lipemia-induced pancreatitis. Her blood came out in the tube and was white with a slight blush to it. It quickly settled into layers, with the top 3/4 being lipid. I don't know what her triglyceride level was because our lab's kit basically came back as 3.6 roentgens per second and sent the sample to a central lab for testing. I went on holiday the next day and forgot to follow up when I got back. Next story. I'm a veterinarian and we use hematocrit instead of hemoglobin because it's more accurate across species, but had a puppy come in oxygen dependent from flea/paranoid anemia. His HCT, percentage of red blood cells, was 4. 4% of the fluid in his veins was red cells. It literally looked like red-tinged water. It's supposed to be 35 to 55%. Treated the fleas, slammed a few milliliters of blood in, he was tiny, and in about 30 minutes, he was bouncing off the walls because he could breathe again. Next story. I'm not a med tech, but I am a phleb. I had a child with blood that was so thin it looked like a Halloween prop. When I dropped off the sample, the med tech did not believe me when I told them it was real and not just me covering up some sort of mess up. I don't know what that child's hemoglobin was, but it was scary low. Low enough that the same med tech was surprised they were alive. I've never seen blood so thin before in my 11 years on this job. It was red-tinted water. Next story. As a severe alcoholic, I would eventually end up in the ER for withdrawal, and they would always do a metabolic panel to test liver function. They never told me the results, but I could look up the lab results, and most were on the red. How my liver and pancreas still work is beyond me. Edit. It looks like the worst one was my SGOT/AST. Normal range is 5 to 40, and I was 74. I think this is also when I was septic with MRSA and also tested positive for COVID. LOL. Good times. Next story. I was getting an EKG at the Cleveland Clinic. My heart rate was 38. After the technician took off, the lead, he says, I'll be right back. I have to go talk to someone. LOL. For some reason, after a couple of years on my heart meds, they started doing this to me. They took me off them, Sodalol, and my heart rate returned to normal. I never felt dizzy or in any way affected by the low heart rate. Next story. Worked hospice for a time. Joint visit with the RN. Patient pulse ox was 18%. Awake, completely oriented, talkative, not short of breath or any other symptoms. Highest it went the entire visit was 25%. We kept trying it on ourselves. Different fingers. Nurse even tried toes. Readings on us were all normal. We straight up told the patient and family, we aren't sure how you're awake and talking to us, but we don't think you'll be with us a whole lot longer. Patient and family extremely understanding. Lived another 18 hours talking and visiting with family, ultimately passing in their sleep. Next story. A few that come to mind. Blood glucose of 1100 and a pH of 6.98 on an old man who's just sitting there. alert and oriented, and talking to me like everything is good. With those labs, he should have been lethargic, confused, and barely opening his eyes. WBC of 0.1 on someone getting chemo induction. HGB of 3.6 on a woman who walked into the ED and complained of feeling really tired lately. Triglycerides over 1200, max the instrument will read. You could see the fat in the lab tube and after the blood draw. Next story. My dad was sent to have films made of either his gallbladder or appendix, don't remember which. They did the scan and sent it to the surgeon electronically. About an hour later, the surgeon himself calls and says he's on his way to the hospital. My dad needs to come immediately for surgery because it's about to burst. A friend works in the lab and said the surgeon came down and read them the riot act because it was obvious it was about to burst and surgery needed to happen immediately. They should have called and told him there was something he needed to look at right then rather than just waiting for him to get the time to look at it. Next story. Not a medical worker, but once my dad had a blood sugar level in the 1980s. I spent 2 days sitting with him as he got treatment in the ICU. Everyone thought I was lying when a new doctor or nurse would come in and ask his blood sugar. I'd be told I must have misunderstood. They'd try a finger poke, it wouldn't work, and they'd have to send my dad's blood to the lab, and it would come back outrageously high. Apparently, he should have been quite deceased, lol. He got last rites and everything. He's 87 now, still diabetic, still kicking. Next story. My husband, at 33 and no extra weight, stopped breathing about 70 times per hour. He's worn his CPAP religiously for the past 20 years. He falls asleep with his mask on, and I'm in bed with my retainer and a skincare mask on. We're the sexiest middle-aged couple ever. Next story. I'm not a medical worker, but I am diabetic, so I have to check my glucose frequently. Once at work, I was checking before lunch, and a coworker who hadn't been feeling well asked me what I was doing, so I explained. She was young and in good health, but was curious, so we checked her glucose too. It was 16. Next story. All sorts of medical problems exist, and my family and I have this weird thing where if I get stressed out at all, my blood sugar absolutely plummets. One time at my school, my head felt a little weird, so I called my mom from the office. It wasn't even really enough to bother me too much. It was just like the feeling when your eyes strain too much and a headache is coming, but it's not there yet. My mom is diabetic, so she decided, I'll prick her finger and see what it is because I know this happens with her. And it was at 31, LMAO. The school nurse panicked so fast and didn't believe me or my mom when we were like, yeah, this just happens sometimes. Just get some juice. If you don't know, normal is supposed to be between 90 to 110. I've never had high blood sugar in my life, and my doctors are well aware of this, so don't worry, lol. Also, that time at my PCP's office was when they were doing my vitals check, and sitting down for over 10 minutes. My heart rate was 240 something. Texted my mom in the parking lot like, oh, heads up, they might not let me leave, so be prepared. Genetics are a fun thing. Next story. The two I can recall, I had a 1.2 potassium come in from an outside facility. I rolled my eyes and called them to tell them it was contaminated, as there's no way someone can have that and be alive. They bring the patient in, a young man in a wheelchair who seemed perfectly healthy and confused as to why they brought him to the ER. Our staff redrew him, and he had a 1.3 potassium this time. Turns out, he was hypokalemic period paralysis or something akin to it. As long as his potassium is low, he couldn't use his legs. The second I recall was we had a blood culture go positive after only 4 hours on Thanksgiving, which is very unusual. Our biofire didn't ID what it was, but only the anaerobic bottles went positive. The ED called the patient's family and told them to bring them back in. The family waiting until after dinner, 3 or 4 hours later, to go to the PT's house and found them in a chair absolutely out of touch with reality. They bring her in and we go to draw labs. We spun it down and took out the centrifuge, and though we'd forgotten to hit start because the whole tube was dark red, we respun it and it was the same. We noticed the gel separator was in the middle, but both halves of the tube looked like whole blood. Our tech, who used to be a microtech at her previous hospital, saw that and was like, Clostridium perfigens! We called the pathologist and tried to get the ED doc to call him to advise him, but sadly, the several-hour delay their family took resulted in her passing away. When they were in the first time, they were just feeling a little sick and had thrown up at work. They didn't make it. Total CP sepsis. Next story. I work in the cath lab where we check the heart arteries of people and place stents, fix blockages if needed. We also fix heart attacks and a number of other things, but anyways, my coworker's 57-year-old dad was having chest pain sometimes. Dad in question was pretty skinny, not a smoker, but a coworker. Son convinced him to have a cath. Coworker came to me personally and told me he asked my boss for me personally to be on the case. I felt a great honor from that. There are 3 arteries that give blood flow to the heart, though they start as 2 in most people. The RCA feeds the bottom of the heart, and the left main splits, or bifurcates, into the LAD, also called the widowmaker, which feeds the front of the heart, and the LCX, which feeds the backside of the heart. Coworker's dad had a 99% left main blockage that also led into a 99% blockage in the start of the LAD and in the start of the LCX. This was one of the worst blockages I've ever seen, but made worse by the fact that we all knew this guy's son could see exactly what we were seeing. We worked quickly to put a cardiac support pump in and transferred him to the ICU, and they did a CABG, open heart, the next morning on a Saturday. Stents were possible, but just too risky with the severity of the blockage. If something went wrong, at least 2/3 of the heart's blood supply would be compromised. Luckily, surgery went great and he's still kicking, but it was a moment I realized how much I really cared about my coworkers. Next story. Last year I was admitted to the hospital due to reaction to my immunotherapy. Grade 3 dermatitis, head to toe, needed IV steroids. I felt like absolute crap. On one of my routine obs, a couple of hours after lunch, the nurse measured my blood glucose as 2.4 mmol to liter. She said, "Oh, that's low. How are you still conscious?" She asked me how I was feeling, and I was like, well, pretty crappy. Same as I have this entire time. She made me have some sugar syrup from a sachet and then measured my blood glucose every 2 hours until they chilled out. Next story. Not a medical worker, but my dad was a diabetic and liked to pretend he wasn't. Only precaution he took was drinking diet soda. It was normal for us to find his blood sugar anywhere from 300 to 700. He passed about 2 years ago now, after several years of dialysis and dealing with the struggles of kidney failure, which, from what I can tell, is like constantly having a terrible stomach flu. Take your diabetes serious, people. Next story. As the patient, I had a vitamin D level of 7. The low end of normal is 30 ng/ml. I felt totally fine while my nephrologist is staring at me in disbelief saying, "So we're going to start you on that." I did about a year of nuclear level, as he put it, 50,000 IU, vitamin D before I got into the low 30s and got downgraded to a maintenance dose, lol. Next story. In college, I volunteered at a shelter for homeless alcoholics. The police would bring people in they found on the streets, and I would check their vitals and get them into a bed. One guy walked in, seemed sober, then blew a blood alcohol level that was well over what I had been taught was a lethal BAC. He seemed fine, walking around, chatting like nothing was wrong. Next story. Many, unfortunately. 1. Platelet count, 13,000. Dengue fever. 2. Heartbeat, 200 plus. 2 to 3 year old patient. It was a long time ago, so I'm unable to recall the diagnosis. Maybe it was congenital adrenal hyperplasia. 3. HB, 3 mgdl. Also a 2 to 3 year old patient. I took her sample and it was like red-colored water. She died after a few minutes before a diagnosis and 'cause her anemia could be established. Next story. Not lab. When I was a medical assistant, I roomed a regular follow-up. Last pulse/EKG were normal. When he came in that day, his heart rate was 35 on the pulse ox. Almost panicked, but realized he was calm, upright, breathing normally, and not in distress. Did an EKG in the room, which showed that he had developed a type of heart block. The doctor went and did his follow-up, and then he drove himself to the ER. Next story. Triglycerides of around 9,000 mgdl. His blood looked like a strawberry milkshake, kind of pinkish with particles floating. It was in 2008, and too bad I didn't have a smartphone to take a picture, but it's imprinted in my memory. The guy at the lab didn't believe the results and came with the remaining tubes to the ER to see who the hell was the guy with the pinkish blood. He had undiagnosed FCH. Next story. A 25-year-old guy came in with an intentional acetaminophen overdose. He crushed up 80 500 milligram pills, mixed them with some green juice, put it all in a Pepsi bottle, and drank it. He fell asleep. His grandma came to check on him and found him unresponsive. Called an ambulance. They brought the bottle with him. The bottom third was white powder. I took a photo of it, actually. I was manually pumping NaC, an antidote in simple terms, into him because it was the fastest way to get it into his system. His liver enzymes were all off the charts, highest I've ever seen in 10 years of medicine. His ALT was 25,000 when I took it the first time, and went up to 80,000 when he was in an ITU. Normal range is up to 130. They were prepping him for a liver transplant, but he refused one, saying he did this to himself and someone else deserves it more than him. Crazy mofo walked out of the hospital 6 days later, with almost normal liver enzymes. No transplant needed. Next story. This won't mean much to many. Baby, a few days old, brought into A&E with umbilical stump continuously bleeding. Applying pressure, not stopping it. While dealing with it, sent basic coag blood tests as well as others. Came back saying, contaminate. Please repeat. Okay, repeat. Same result. Did it once more and same sodding result. Usually this result meant it's been with an anticoagulant from another blood tube. Can happen if you use the same needle to put in a tube before you put it in the coag tube. But the second and third samples were the only samples taken at those times. Call a lab and ask why they think it's contaminated. All values are sky high and means there's an anticoagulant in the sample. This included PT, APTT, fibrinogen, INR, for those who know what this means. Basically, this blood has every clotting thing wrong with it according to this test, so it can't be right. Ask, could this be a factor in deficiency? Lab test said, possibly. I think it's time to call the consultant. Called the consultant, explained and asked could this be factor 1 deficiency. Never heard such an excited and curious, ooh. Bingo. Diagnosis, treatment started. Baby all good. Found out later that the lab tech had been trying to call the consultant too after I talked with the lab. I just got through first and sounded impressive first. Next story. A patient kept having unexplained hyperglycemic episodes. Her blood was tested and large amount of insulin was found. The insulin lacked the C-peptide. C-peptide is present in the natural insulin the pancreas secretes. If someone is naturally secreting too much, the C-peptide should be present. It wasn't. She was a doctor's wife who had access to insulin injections. She was injecting herself to produce hypoglycemic episodes to seek sympathy. Next story. The worst one I had recently was a patient with a recent heart transplant on ECMOs whose blood was so hemolyzed that when we spun it down in the centrifuge, it still looked like whole blood. The techs on the previous shift kept recollecting it rather than investigate what was going on. No labs could accurately be ran on him other than maybe a CBC due to the hemolysis rate. Had to get clinical directors involved. It was so bad. He did not make it. Next story. Had a patient that had 13 types of bacteria detected in her spinal fluid. I don't remember the exact mechanism of how it got in there, but I think she had a severe sinus infection that spread respiratory bacteria into her spinal fluid. She also ended up having a stroke from it. She ended up getting IV antibiotics for a few weeks, but survived. Spinal fluid is sterile, and even getting one type of organism in it is called meningitis. Meningitis can be fatal. Bacteria and brains don't mix. Next story. I had the pleasure of taking care of a lovely man with HbG of 1.9 who needed blood transfusions every few weeks because he had MDS. He'd been on our observation floor. Was a pleasure. So nice and brave in the face of his disease. I then had the displeasure of catching his fever upon his second blood transfusion of the stay. He often needed at least 3 units before discharge. I thought it'd be an easy fix and that I was too new to know what it was. I was so proud that I knew to hold the second infusion. We just slowly administered with Benadryl. After that, he was admitted to our inpatient unit where I could still take him, but he was given to the senior nurse every shift. He'd come in more often for transfusions until he was having blood transfusion reactions every time. He'd started being admitted to ICU. Every nurse in the hospital, from the ED to the lab to observation to med-surg to ICU, spoke of how nice and appreciative this guy was. I did ask my senior nurse why this guy wasn't eligible for a stem cell transplant, but at this point, I was off the case. Eventually, blood transfusions stopped working for him, and we kindly let him die in the ICU as comfortably as we could. I still think of him often. It's been a few years. R.I.P. BJ, you changed me for the better. Next story. We had a kid one time we were going to put a chest tube in. The surgeon walks in and says, "This is going to take maybe 10 minutes. The kid was highly autistic. The surgeon gets the chest tube in, and anesthesia was waking the kid up. I even remember hearing anesthesia say, "It's okay, buddy, you're just waking up." I started hearing his pulse ox getting lower. His pulse ox goes down, then back up. Down for a while, then back up. Then I hear anesthesia say, "We're astolic." We started CPR, called rapid response. We worked on this kid for probably 30 minutes. Eventually, they call it. The kid dies right there in the OR. They bring the mom in to see him. Let me tell you, no sound on earth is as heartbreaking as hearing a mother wailing after their child dies. I hate it. The surgeon is crying. It was just a bad situation. About a week later, I saw the surgeon again. He said the kid's autopsy showed he had severe lack of vitamin C and developed scurvy. Apparently, this kid ate nothing but mac and cheese and chocolate syrup. The kid could have been saved with a multivitamin or orange juice. Yeah, that's every parent's worst nightmare, is outliving their children. And for something that's so preventable, I mean, gosh, that's heartbreaking to read. Next story. So, I work in an outpatient lab, and I draw and run a few tests. Well, one day we had this maybe late 30s or early 40s man come in, and he was not well at all. Like, he was in a wheelchair and couldn't lift his head bad. Well, we got his blood and ran a stat CBC per the provider. As it turned out, this poor man had a WBC of 70-something, and his platelets were in single digits. To put this into perspective, WBCs are in critical levels at around 16 per our machine, and our providers will send most people with WBCs at around 18 to 20 to the hospital, and platelets are supposed to be somewhere around 150 to 400. I don't know quite as much about them as the WBCs, but yeah. I obviously brought the result to the provider, and they, who had been in medicine for at least 40-ish years, said they'd never seen WBCs that high. Safe to say, the poor guy and the family member with him went straight to the ER. From what the provider told me, he coded not long after they got him back into a room, and the family decided to withdraw life support, as opposed to him spending the rest of his life, which probably wouldn't have been very long as his cancer had come back, out of it and on machines. It's probably been a good year since that patient, but I still think about him and his family from time to time. Next story. My brother passed out drunk and couldn't be revived by family. My nephew called an ambulance who took him to the hospital. They performed CPR on him for 28 minutes. They never go beyond 30 minutes at that hospital before they finally got a faint pulse. At that time, he tested at 0.76% blood alcohol. His hospital said it was by far the highest they had ever seen in a surviving patient. He was in a coma for 6 weeks, but did recover.